Hi everyone, Dr. Chiam here. We've got some questions from patients about laser resurfacing. What does laser resurfacing entail? And is laser resurfacing suitable for you? Basically, what laser resurfacing is, it is a procedure in which a laser device is used to improve surface flaws to the skin. And such flaws include conditions such as scars, wrinkles, fine lines, and textural issues such as open pores. In general, laser resurfacing can be done with both ablative or non-ablative lasers. And for the ablative lasers, the commonest lasers we use are the carbon dioxide laser and the erbium laser. The wavelengths of light emitted by these lasers target water, and because our skin cells are composed of mostly water, this actually produces a burning effect on the skin. And with the superficial layers of skin removed, the skin regenerates with improvement of the skin surface issues as it heals. Because of its invasive nature and the risk of infection, full ablative laser resurfacing often needs to be done in an operating theatre setting under general anesthesia. And because of this, the procedure also carries with it a significant recovery period, often lasting a few weeks. Because most of the superficial skin is taken off, the procedure also has a significant risk of infection and scarring. And amongst darker skin patients, there is a high risk of problems such as post-inflammatory hyperpigmentation. So later versions of the CO2 and erbium lasers introduced a fractional mode to the lasers. In fractional lasers, instead of the entire superficial skin being removed, the machines fire small holes or columns in the skin surface, ablating less than 15 to 20% of the skin surface, and the untreated areas of skin then help with the healing process by producing growth factors necessary for growth and remodeling of the new skin. And this method produces less downtime for the patients. I have generally refrained from using ablative lasers such as the CO2 laser these days, and I have a separate video in which I explain in detail the reasons why, and also talk about some safer alternative treatments I offer patients looking for resurfacing treatments for scars. These treatments often include ablative radiofrequency or radiofrequency needling. Non-ablative laser resurfacing has made significant improvements in the past few years, particularly with the advent of picosecond lasers. Traditionally, non-ablative laser resurfacing was done with lasers such as the long-pulsed Nd:YAG laser, basically to stimulate collagen growth in the skin, producing some tightening and skin remodeling. These treatments had a very low downtime for the patients, but required many treatments with actually very modest results. So the picosecond lasers, both the 755 nanometer and 1064 nanometer wavelengths, provide an interesting alternative for non-ablative laser resurfacing. A special feature of picosecond lasers, due to the power they are able to generate, is this phenomenon known as LIOB, or light-induced optical breakdown. With this special mode, the laser is able to fire and produce small gas bubbles under the surface of the skin, which is a little bit like the controlled skin injury of a fractional laser, just that there is no breach of the superficial skin barrier. So this produces good skin resurfacing and rejuvenation effects to the skin with a much better safety profile as well as a shorter downtime for our patients. And I typically use the picosecond lasers for resurfacing in patients who have mild to moderate skin surface issues or who are unable to take the downtime of a full resurfacing procedure. So if you have troubles with skin surface issues such as scars, open pores, fine lines and wrinkles, and you are looking and wondering which resurfacing treatment is more suitable for your condition and lifestyle, do drop us a call and we will be most happy to have an in-depth discussion with you in person.